public health agencies and virologists continue to monitor the landscape of rare but severe respiratory illnesses, with a specific focus on Hantavirus Pulmonary Syndrome, or HPS. While the condition is infrequent in terms of total annual case numbers, it remains a primary concern for surveillance teams due to its high mortality rate and the aggressive speed with which it can overwhelm previously healthy individuals. First identified in the United States during a 1993 outbreak in the Four Corners region of the Southwest, HPS fundamentally changed the medical understanding of rodent-borne diseases in the Americas. Before this discovery, hantaviruses were primarily associated with hemorrhagic fever with Raynaud syndrome, a condition more common in Europe and Asia. The emergence of a respiratory-focused variant marked a significant shift in infectious disease reporting. The syndrome is categorized by a rapid and often devastating progression from mild, non-specific symptoms to acute respiratory failure. In North America, the primary viral agent is the sin nombre virus, which finds its natural reservoir in the deer mouse, known scientifically as Peromyscus maniculatus. It is essential to understand the biological mechanism of transmission to frame why this virus is so distinct from more common respiratory infections. Hantavirus is not typically spread from person to person in the North American context. Instead, the risk to human populations stems from contact with the excreta, saliva, or nesting materials of infected rodents. When these materials are disturbed, such as during the cleaning of a shed, barn, or seasonal cabin, the virus can become aerosolized. This means microscopic particles enter the air and are subsequently inhaled by anyone in the vicinity. This specific mode of transmission explains why the virus often impacts healthy, active adults who are engaged in domestic or occupational cleaning in rural or semi-rural environments. The initial prodromal phase of the illness often includes fever, chills, and significant muscle aches, particularly in the large muscle groups of the thighs, hips, and back. Because these early signs mirror many other viral infections, the gravity of the situation may not be immediately apparent to the patient or the primary care provider. However, the window for intervention is narrow, as the transition from the early phase to the more dangerous cardiopulmonary phase can occur in as little as 24 to 48 hours. Understanding the geography and the specific rodent reservoirs is the first step in public health framing, as it allows officials to target education efforts toward those most likely to encounter infested environments. As surveillance continues, the scientific community remains focused on why this virus triggers such an extreme immune response in the lungs of people who otherwise have no underlying health conditions. The clinical progression of Hantavirus Pulmonary Syndrome represents a complex challenge for hospitals and specialized laboratories, as there is currently no specific antiviral treatment, vaccine, or cure approved for the disease. Once a patient enters the cardiopulmonary phase, the virus begins to damage the endothelium, the thin layer of cells lining the blood vessels in the lungs. This damage causes the vessels to leak fluid directly into the alveolar spaces, leading to a condition known as non-cardiogenic pulmonary edema. Patients experience a sudden and severe onset of shortness of breath, often described by clinical reports as the feeling of suffocating while the heart continues to function normally. In this stage, the phrase "doctors are powerless" reflects the reality that there is no medication to stop the viral replication or immediately reverse the lung damage. Instead, medical teams must rely on intensive supportive care. This often involves the use of mechanical ventilation and, in the most severe cases, Extra-Corporeal Membrane Oxygenation, or ECMO. This advanced technology involves pumping the patient's blood through an artificial lung to oxygenate it outside the body, allowing the patient's own lungs a chance to rest and potentially recover. Laboratory diagnostics are critical, but can be time-consuming. Confirmatory testing is typically performed at state or federal reference labs using techniques such as enzyme-linked immunosorbent assays, or ELISA, to detect specific antibodies, or polymerase chain reaction, known as PCR, to identify the viral RNA itself. Because these results may take days to return, physicians are often forced to make treatment decisions based on clinical suspicion and a history of potential rodent exposure. Public health agencies like the Centers for Disease Control and Prevention and the World Health Organization emphasize that early admission to an intensive care unit is the single most important factor in survival. If a patient is managed in a high-level facility before the respiratory distress becomes irreversible, the chances of recovery increase significantly. However, even with the best modern medicine, the mortality rate for HPS remains approximately 35 to 40%. Surveillance data from across the Americas, including South American countries where different strains like the Andes virus exist, shows that hantavirus persists as a consistent threat in regions where human habitats overlap with rodent populations. In South America, researchers have documented rare instances of person-to-person transmission involving the Andes strain, which adds another layer of complexity to international public health logistics and quarantine protocols. For now, the global medical community remains in a state of constant vigilance, contrasting the headlines of powerless medicine with the rigorous, life-sustaining efforts of ICU teams who work to bridge the gap between acute failure and natural recovery. Prevention and environmental management remain the primary tools for public health officials in the absence of a clinical cure. Because the virus is so closely tied to rodent populations, surveillance efforts often include monitoring the density of deer mice and other carriers in specific regions. Environmental factors, such as increased rainfall or mild winters, can lead to a masting event, an abundance of seeds and food that causes rodent populations to surge. Public health guidance is centered on a concept known as integrated pest management, which aims to keep rodents out of human living and working spaces. The most critical advice provided by agencies involves the safe cleaning of potentially infested areas. Officials warn never to sweep or vacuum rodent droppings or nesting materials, as these dry actions are exactly what causes the virus to become airborne and breathable. Instead, the recommended protocol involves thoroughly wetting the area with a disinfectant or a mixture of bleach and water. This prevents the particles from lifting into the air. Only after the area has soaked for several minutes should it be cleaned using paper towels or mops, while the individual wears rubber or plastic gloves. In areas with heavy infestation, the use of professional-grade respirators, such as N95 masks, is often advised. Beyond individual cleaning practices, public health statements emphasize the importance of sealing holes and gaps in homes, keeping food in rodent-proof containers, and removing brush or wood piles from the immediate perimeter of a residence. There is still much that remains unknown about hantavirus, particularly regarding why some individuals develop more severe immune reactions than others, or the exact long-term respiratory impact on survivors. The limits of current knowledge mean that education and awareness are the most effective barriers against the disease. While the medical community works toward better diagnostic tools and potential therapeutic interventions, the focus stays on the ground level, identifying risks before they turn into infections. This calm, methodical approach to prevention is the standard response to a pathogen that, while rare, leaves little room for error. Travellers and residents in rural areas are encouraged to stay informed through their local health departments and to report any unusual clusters of rodent activity. By understanding the environment and respecting the biological risks, the public can significantly reduce the likelihood of exposure. For more deep dives into public health reporting and emerging viral threats, consider subscribing to this channel to stay informed on the facts that matter. The clinical progression of Hantavirus Pulmonary Syndrome, or HPS, represents one of the most significant challenges for modern intensive care units and diagnostic laboratories. Once the initial prodromal phase of fever and muscle aches passes, the virus moves into the acute cardiopulmonary stage, a transition that public health agencies describe as both sudden and severe. At this juncture, the virus targets the endothelium, which is the delicate lining of the blood vessels. Specifically, the viral load causes these vessels in the lungs to become permeable, leading to what clinicians call a capillary leak syndrome. Unlike typical pneumonia, where an infection causes inflammation and mucus, HPS causes the patient's own plasma to leak directly into the alveolar sacs of the lungs. This results in non-cardiogenic pulmonary edema, meaning the lungs fill with fluid even though the heart is initially functioning normally. From a reporting perspective, the statement that doctors are powerless refers to the lack of a specific silver bullet intervention There are currently no FDA-approved vaccines, nor are there specific antiviral medications like ribavirin that have proven effective against the respiratory form of the virus in clinical trials. Instead, hospital intervention is strictly supportive. For patients who reach a state of respiratory failure, the standard of care involves rapid intubation and mechanical ventilation. In the most advanced cases, where ventilators are insufficient to oxygenate the blood, hospitals may employ Extra-Corporeal Membrane Oxygenation, known as ECMO. This process involves bypass technology that removes blood from the body, artificially removes carbon dioxide, adds oxygen, and pumps it back in, essentially doing the work of the lungs to allow them time to recover from the viral assault. The role of diagnostic laboratories is equally critical and fraught with logistical hurdles. Because HPS is rare and mimics other respiratory illnesses in its early stages, many local clinics may not immediately suspect hantavirus. Confirmatory testing is generally not available as an on-demand bedside test in most community hospitals. Samples must typically be sent to state public health laboratories or the Centers for Disease Control and Prevention's Viral Special Pathogens branch. These labs utilize enzyme-linked immunosorbent assays, or ELISA, to look for specific IgM and IgG antibodies that indicate a recent or active infection. They may also use polymerase chain reaction, or PCR, to detect the presence of the viral RNA itself in the blood or tissue. Because the window for effective treatment is so narrow, physicians often have to make high-stakes decisions based on a patient's low platelet count or a specific type of white blood cell called an immunoblast seen on a peripheral blood smear, which can serve as a clinical red flag for HPS before the official lab results return. On a global surveillance level, the tracking of hantaviruses involves a complex network of agencies monitoring different strains. In North America, the sin nombre virus is the primary concern, while in South America, strains like the Andes virus present an additional layer of risk. Unlike the North American variants, the Andes virus has shown a documented, albeit rare, ability for person-to-person transmission, which changes the protocols for healthcare worker safety and patient isolation. International health authorities contrast the verified data, which shows that early ICU admission significantly improves survival rates, against the sensationalized claims of total medical helplessness. While the mortality rate remains high, hovering near 35 to 40%, the narrative within the medical community is one of aggressive management rather than surrender. Surveillance teams continue to analyze data from shipping and travel sectors. Though HPS is rarely linked to international commerce, it remains a disease of environment and local rodent-to-human interaction. The struggle in the clinical setting is a race against time, where the speed of the body's immune response is often the deciding factor in whether the supportive measures provided by the medical team can bridge the gap to recovery. Prevention and environmental management remain the primary tools for public health officials in the absence of a clinical cure or a preventative vaccine for Hantavirus Pulmonary Syndrome. Because the virus is so closely tied to specific rodent populations, surveillance efforts often include monitoring the density of deer mice and other carriers in various regions. Environmental factors, such as increased rainfall or mild winters, can lead to a biological event known as a masting year, an abundance of seeds and food that causes rodent populations to surge and, consequently, increases the likelihood of human-rodent interactions. Public health guidance is centered on a concept known as integrated pest management, which aims to keep rodents out of human living and working spaces through physical barriers and sanitation. The most critical practical takeaway provided by agencies involves the safe cleaning of potentially infested areas. Officials warn never to sweep or vacuum rodent droppings, urine, or nesting materials, as these dry actions are exactly what causes the virus to become airborne. This process of aerosolization allows microscopic viral particles to lift into the breathing zone of the individual. Instead, the recommended protocol involves thoroughly wetting the area with a disinfectant or a mixture of 1 part bleach to 9 parts water. This prevents the particles from lifting into the air and effectively deactivates the virus on contact. Only after the area has soaked for at least 5 minutes should it be cleaned using paper towels or mops, while the individual wears rubber or plastic gloves. In areas with heavy infestation or poor ventilation, such as crawl spaces or attics, the use of professional-grade respirators, such as N95 masks, is strongly advised to provide an additional layer of safety beyond cleaning. Public health statements emphasize the importance of long-term property maintenance to reduce risk. This includes sealing any holes or gaps in homes that are larger than 1/4 of an inch, roughly the width of a pencil, using materials like steel wool or cork that rodents cannot easily chew through. Keeping food, including pet food and bird seed, in thick plastic or metal containers with tight-fitting lids is essential to avoid attracting reservoirs to the home. Outdoors, residents are encouraged to remove brush, rock piles, and trash from the immediate perimeter of the residence to eliminate nesting sites. While these measures are highly effective at reducing exposure, there is still much that remains unknown about the virus from a scientific perspective. Researchers are still investigating why the immune system in healthy adults often overreacts to the presence of the virus, leading to the devastating cytokine storm and subsequent lung failure that characterizes the syndrome. The limits of current knowledge mean that education and awareness are the most effective barriers against the disease. While the medical community works toward better diagnostic tools and potential therapeutic interventions, the focus stays on the ground level, identifying risks before they turn into infections. Reporting on such high-mortality pathogens requires a balance of transparency regarding the risks and a focus on the tangible steps the public can take to stay safe. Ethical public health reporting eschews sensationalism in favor of actionable evidence, recognizing that while the disease is severe, it is also rare and largely preventable through informed behavior. This calm, methodical approach to surveillance and education is the standard response to a pathogen that leaves little room for error. By understanding the environment and respecting the biological risks, the public can significantly reduce the likelihood of exposure. For more deep dives into public health reporting and emerging viral threats, consider subscribing to this channel to stay informed on the facts that matter.